Well, it's the top of the hour. We will go ahead and get going. Just wanted to say thank you to all of you for taking time out of your day to join us for our first Regional Community Coalition quarterly call. Obviously, we will be holding these regionally and quarterly. And the schedule, we have our next call will be October 27th. You can register in advance. When you registered for this call, you should have also received the invites for the remaining calls for the rest of the year, but if you did not, you'll have to register again for the next call in October. So if you have any issues, you can get a hold of one of us too at Mount Pacific. Just a few logistics. Just make sure you're muted during the call unless you want to ask anything or have something to say. You can also use the chat function to type any questions or concerns. Also, just please feel free to share your experience, any tips, tricks, anything like that. So with that, so we did talk about this during our May past quarter kickoff call with the coalitions, but I just wanted to reiterate a little bit again about our community coalition approach. So the past scopes of work were very task oriented, diabetes with providers and beneficiaries, hospitals and quality reporting, providers and quality reporting, and now it's a movement starting in the last task order towards working with coalitions and collaboratives. This newer approach is almost entirely coalition focused with only a few areas of specific technical assistance. And our team is working in alignment with each other instead of siloing our approaches and technical assistance. And then also throughout all of our work, whether it's a federal CMS contract or a non-federal contract, we value the powerful partners and strive to ensure that patient and family voice is echoed in our approach. And of course, the pandemic has thrown a wrench in how we plan to do our work, and now more than ever, it takes a team, but really it takes a community to achieve the success we all want to see for the end users of our healthcare system. So it sounds like somebody might still be not on mute, so if you want to just make sure and mute your lines if you don't have a question. And then, as I mentioned, that our work is shifting from a state-focused or specific task-focused approach to a regional all-share and reap the benefits approach. These quarterly calls will help keep coalitions apprised of the work being done in other coalitions as a region. So it's really meant to be sharing. So if you have something to share, we'd love to hear it. We will showcase our powerful partners today, similar to what we'll be doing here momentarily, and then show how they're moving the needle within their communities by reviewing their processes and outcomes so that best practices can be developed, spread, and then sustained throughout our region. And our plan is to be that support system that helps your coalition stay focused, as well as produce ideas for interventions your coalition is capable of, and how to implement those interventions. And last but not least, how to track and measure the outcomes. So type your answer in the chat box. Do you have work that you would like to showcase during the next regional coalition call in October? And you can just type yes or no, and we will reach out to you. Don't be shy, we're not going to call on you today, but we would love to have you share your tips and tricks and any project outcomes with us too. So if you would, one of us will reach out to you and we'll get some information from you for the next call. So we have a polling question here. Mary, you can go ahead and pop up that polling question. And it's in your current coalition work, which goal aligns with your current focus? So it'll be goal 1, 2, 3, or 5. You can choose multiple goals here. And then again, during our regional coalition kickoff call, we discussed how Mountain Pacific remains the same with that regional approach. And our team has account managers for your local coalition, which will allow us to be more flexible and align like work with this task order and other state and local initiatives. And we're already trying to align activities, as I previously mentioned, and we'll go over one of the ways we're doing that in just a bit. And of course, we know one size won't fit all, but the approach and resources are really applicable to most. And to eliminate the amount of time that each of your coalitions may spend on identifying interventions to apply for community solutions to address the goal metrics, helps to free up time and resources within your community coalition to focus on community issues that are specific to you. So somebody is not on mute unless you have a question. The scope of work will focus on improving behavioral health outcomes. So that'll include opioid misuse with focus areas like decreased opioid related adverse drug events and overdose related deaths, implement pain and opioid best practices, as well as access to treatment for mental health conditions. And then goal 2, increase patient safety, which is a big emphasis on infection prevention. And this focuses on reducing the rate of hospitalizations for adverse drug events in all community settings and reducing rate of hospitalization for C. diff. So I see we still have some people haven't voted yet. And then goal 3, increase chronic disease self-management. We have a lot of metrics to offer on that one, such as improve management of diabetes, achieve a 55% referral to diabetes prevention program, and contribute to preventing cardiovascular events, among many others. And then 4, increase quality of care transitions involves improving all-cause hospital admissions and 30-day readmissions and reduce rate of emergency department visits and admissions by super utilizers. And then last but not least, improve nursing home quality is focusing on improving the mean total quality score and reduce the percentage of nursing homes with a total quality score of 1258 or less. Also reduce healthcare related infections in nursing homes and reduce ED visits and hospital readmissions. So can you see the polling results here? We have so far 19. A lot of people focusing on goal 3. So that is good to know. And this is going to help us we use the data wish list that we had sent out to coalitions as well, but it's also good to see this to see what other focus areas we can help you with. So now we're going to start in with our powerful partners and just to do a showcase of collaborative work with community coalitions. And first up, Mark, I'll let you introduce Lisa.
Lisa Moala is a very gracious and caring community leader who works with Alulike as a program specialist, doing outreach for the Ke Olopono no Nakapuna program, which translates into the well-being of seniors. There are 4 program sites on Oahu, each serving as a patient and family advisory group for Mountain Pacific in 4 distinct zip codes. The Kapuna engage in cultural activities that include hula, Hawaiian language and Hawaiian history. Intergenerational activities with children and young adults from the community are encouraged, and the PFAC participants at all sites provide feedback on health monitoring, health promotion and education, nutritional counseling, physical activities, and supply a much needed voice for each of their communities here on Oahu. So, Lisa, take it away. Can everybody hear Lisa? Say, hello? Can everybody hear?
Hi.
Yeah, everybody's shaking their head. Okay, great.
Okay.
Yeah.
I want to thank Mark for letting me speak for a little bit because your involvement with our community is very crucial to their health. And we are first and foremost a nutrition and health organization. We want our kupuna to live a long, healthy life. And Mark and Joe have been very pivotal in helping us do that. First of all, we started off many, many years ago with a virtual bowling. So keeping the kupuna active through bowling, and it has gradually changed with the times to becoming a patient and doctor kind of. He asked the kupuna for advice on different directions he gives them, and then they give their responses and give their input into the questions he's asking that actually go into your paperwork. So I really appreciate that he's been very instrumental in our community. Our kupuna are 60 years and older, and they are all Native Hawaiians. We deal with a Hawaiian population, which in Hawaii is a very actually unhealthy population of people. So with the guidance of our program and with Mark and Joe coming in, Joe giving exercise and Mark giving the directions, we've talked about diabetes and all aspects of health. And he's been very instrumental in helping us guide our kupuna to healthier lives through measurement, through exercise, through healthy eating, through Medicare health. Did I cover it all, Mark?
Yeah, I think so. Yes. Thank you,
Did everyone
Lisa.
hear that?
Yeah, thank you, Lisa, very much. So we know
Yeah.
we know you're busy, so
Thank you.
yeah, so get back out there and feed those folks, okay?
Yes, thank you. Thank you so much.
You're welcome. Thank you. Yeah.
Thank you so much for sharing, Lisa.
Oh, you're
Very-
welcome. During this time of COVID too, we've been daily giving out food to the kupuna because a lot of them can't cook on their own, and they are stuck at homes, a lot of them alone. So we've been doing kind of an outreach to them and feeding them as well. So that's just during the COVID times. So we kind of miss Mark and Joe. We don't get to see them as often, but yeah, it is these times. So we do what we can.
That's right.
Thank you.
Thank you. Thank you very much. Yes, for certain, during these times, it makes us have to think outside the box and how can we creatively continue to serve our communities.
Yeah.
So up next, we have Crystal Morse. She is one of our Wyoming Mountain Pacific team members. And so Crystal, I'll let you introduce yourself and a little bit about what you did.
Okay, thanks, Alana. Can you guys hear me okay?
Yep.
Okay. Well, I was fortunate enough to take over the Casper Coalition in December of 2017. So today I'm going to highlight the COPD success that we've had with our Medicare readmissions. So if you were a part of Alana's coalition building series earlier this summer, you would have heard her say to conduct a skills inventory of your coalition group. And here's why. By doing this, the Casper Coalition was fortunate enough to find a Six Sigma black belt lean trainer who is able to coach the coalition into their success. So the method that we used for this was called the Plan, Do, Study, Act, or PDSA. Next slide, please. So as you can see from this graph, we strategize by using the HCAP survey results. So for those of you who don't know what HCAP surveys are, it's a questionnaire it's a 29 questionnaire sent out to people that were just recently discharged from the hospital. So they ask questions, how was communication with your nurses and doctors and the responsiveness of hospital staff? What, was it quiet? Was it cleanly? And so here you can see, I pulled this. This is the latest from Hospital Compare. And they're asking, do you feel that you strongly understood your care when you left the hospital? And so as you can see, it's not only an issue between Wyoming Medical Center, it's an issue in the state, and it's nationwide. So 50% of patients that discharge feel that they are prepared and understand their care. Next slide, please. So as you can see from this graph, our rehospitalization spiked in July of 2019. And we really joked with the pulmonary disease coordinator saying it's really her fault because she takes vacation in July. So really, all joking aside, because of time, I'm just gonna go ahead and highlight some of the innovations shared by the coalition group. So some of the root cause we found was we increased our Cerner access and training. So Cerner is a large EHR and it's a lot to navigate. So Wyoming Medical Center created trainings for providers to utilize Cerner more efficiently. Define labs, SAT-Gs, and define immunizations. Mountain Pacific was also able to capture trainings to help seniors to get into their portals. So Wyoming Medical Center was a partner and helped doing tutorials for our seniors to help them get into their portals. We found a lack of resources to be not available in our community, and transportation was a big barrier. So therefore, we developed a transportation committee, and AARP actually spearheaded this. So I want to encourage you to not forget about your national partners, as they can be a big help with resources and in some cases funding opportunities. And then what I really saw, maybe nobody else did, but what I really saw was it changed. It changed ways of thinking from we've always done it that way to it completed more of a buy-in process, and we heard different perspectives. So from stakeholders, and they knew that they were being part of this change. Hope Health partnered with hospitals to create a caregiver boot camp. So this was a 12-week boot camp, and it was preparing caregivers to care for their loved ones with chronic diseases. We also developed a readmissions task force between skilled nursing facilities, and quarterly education to their staff was completed. And then for the end user, they wanted to know if they were looking at a high-risk patient or not in Cerner. So we developed, we got with the IT department at the hospital, and now they're flagged. So when somebody goes in there to see a patient, it'll be flagged that they're high risk. And then our pulmonary coordinator interviewed those that were readmitted to the hospital for COPD and chronic disease, and discussed it with the readmission team, reflecting the discharge process and possibly what went wrong. So as you can see at the end, our numbers came way down. We were below the national average to 13%. So next slide, please. So some lessons learned. Obviously, we left out the patient. So again, we could have asked them, why are you not feeling prepared to go home? What was the reason? By doing this root cause, it could have probably presented, we could have been done with it a lot faster. But yeah, we left out the most important part, was the patient and the patient advocate. So this slide you're viewing right now is our strategic plan that we developed in January, and it's our recruitment. Who will add value? So you better bet we're going to start recruiting patients and patient advocates to be on our coalition team. And that's all I have to add, Alana.
Awesome, Crystal. I appreciate how you kind of ended it with how you evaluate it and how you're putting it into your next plan. Great job.
Thank you.
All right, and up next we have Joanne. And so Mark, I'll let you introduce Joanne.
Great. Super. So Joanne Bates is the Director of Utilization Management, Case Management, and Utilization Review at the Maui Memorial Medical Center, which is the only acute care hospital on our Valley Isle. Our Maui Partner Coalition, which a number of folks are on this call today, have been working together since 2011. And the coalition has been an excellent networking opportunity for caregivers and providers who are committed to providing high-quality, patient-centered, affordable community care. Joanne is the coalition lead for the Maui Partner Coalition and one of the most generous and effective healthcare leaders, and I'm happy to say a good friend. So Joanne, take it away.
Hi everyone, thank you for having me. Mark and Maggie has been wonderful with their guidance with our QIO, and we would not be where we are without them and their expertise. I do have to say that this all started many years ago. He mentioned 2011, and with their guidance, we did get a grant with the CCTP Community Care Transitions Team. In the very beginning, we were the only hospital here on Maui, and I believe Hawaii, to have this grant to start off with the coaches to transition with the hospital and our patients. And I can say that we still have that. It's not necessarily funded via that grant any longer, but with Maui County Office on Aging, they've been instrumental with having that partnership, and back in 2011 till now, we have all been benefiting from that grant and from that service. Our team has grown quite a bit. Our goal has always been to, one of them, reduce 30-day hospital readmissions with the help of our community coalition, and also with looking at high-risk medications and medication safety with our patients. And in our team, not just with Maui County Office on Aging, we've been able to include our home health, which is Beata Home Health, Halemakua Home Health, Hospice Maui, Islands Hospice, the hospital itself, which is Maui Memorial Medical Center. I mentioned Maui County Office on Aging. We also had our mental health Hawaii advocate come and be a part of our coalition, Times Pharmacy, Halemakua Home Health, Kula Hospital. We've also had Kaiser to come into our meetings. We've had independent living partnerships with Rosalani, and also HMSA, many coordinators there. I believe some of them are on now. We also have our care resource. We've had Maui Independent Living, MEO, Maui Economic Opportunity. We've also had, let's see, GAMI Home Care, Department of Health, and many other caregivers that's been a part of our coalition. I do think that we have been invested in this coalition because the hospital, like Mark had mentioned, we're the only acute care hospital. And so without the community partners, we would not be able to focus on preventing any readmissions into the hospital. Nationally, you mentioned that the readmission numbers have been at 13%. I think when we first started, it was 17%. Our Medicare goals, and we thought they were lofty at the beginning. Our community readmission target goal was 7%, and we actually reached that goal last year. So we're trying to maintain that, and we can't do that without all of our partners that have been instrumental in trying to prevent that goal. A lot of community sharing, a lot of education with everyone, improving transitions of care by setting that goal. You mentioned one of the goals nationally was the opioid crisis. We actually had a DEA agent come and do a presentation for the hospital as well as for our coalition at one point. We also work with our diabetes educator. She'll come and do a speech with our and do a presentation with our team, so we can work with the patients out in the community. We've also worked with our community partners to help with our advanced healthcare directives to make sure those are a goal, because it was a federal mandate for us to give information there and post information. So they've been starting in the community and helping us to prevent some of that, not having a power of attorney into the hospital, because we had issues with that as a primary spokesperson for a patient. Also last year in our scope of work, in the 11th scope of work, The National Coordinating Center had acknowledged Maui community partners with their data analysis. They found that Maui community also performed well with reducing utilization of hospital services for their frequent patient utilizers. So again, that goes to show that our community partners have been working very hard to keep our readmissions on the low side and make a difference with the data with our patients, keeping them home, keeping them safe, keeping them with all the information they need, following up with their PCPs, providing the care that they need with our home health, with our independent providers, and also letting them know that the hospital is there for them no matter what. We share a lot of information together, especially with our meetings that we have. We wouldn't be able to do it without our partners. And I think that goes with Mark and Maggie being so instrumental, influential, and sharing all of their knowledge and their background with the QIO. And the QIO also has been, and thank you to all of you, they've been helping us with our community presentations that we have for the hospital with diabetes, with cardiac, with our stroke events, and our health fair. So they've been helping us with our medication bags, with our education material for our patients, and also just being supportive with the team and with the hospital. And I think we are going to continue to grow. We've changed a little. We're not meeting, of course, due to the COVID. We're doing it via the Teams. But I think it's made us closer just because we know we have to focus on those patients that really need the help and can't have the hands-on. So a lot of education with telephone, via Skyping, via emailing, and also the community partners have been delivering meals to some of our patients and trying to do the social distancing. So we have been trying to support one another in this pandemic. And I think we'll continue to grow and continue to be strong and keep up with the prevention of readmissions and continue to keep it at that 7.
Great. Thank you so much, Joanne. It sounds like you have a very, very active and engaged coalition, and I appreciate that you've set the goals and you understand just listing all of your community partners and how instrumental it is to move the needle by bringing in all of those. So kudos and very, very good job.
Thank you.
All right, and so up next, we're just gonna go through briefly about the Coalition Data Wish List. This is the assessment that Mountain Pacific had sent out to our community coalitions, and this was just to help understand what data needs and priorities the coalitions had. So, Mary?
Yes, can you hear me okay?
Yep.
All right. So our coalition data wish list was sent out in June. It went over the course of the month, and we received about responses from about 10 or 11 coalitions, which is about 50% of our coalitions. But we also recognize that a lot of our coalitions had either needed to kind of pause in meeting due to the COVID pandemic, as well as several of them are new. And so we will probably be doing this again later in the fall when some of you have had a chance to really meet and get to know your coalitions and the work that you want to do in your communities a little bit better. So overall, we felt like it was at least a representation of what we and of our coalitions, and gave us a little direction on what we needed to do, because what we were hoping, thank you, Alana, what we were hoping to glean from this, with the issues that we're having with getting data from CMS, we were hoping to understand what your needs were locally, so that when we have access to the data, we can start with the things that are most important to you, and then we can work on the rest of what we need, you know, as we get down the path. So we really appreciate the time and effort. I know that it was a fairly long assessment, so thank you for taking the time to do that. So we asked respondents to prioritize from high to low 26 specific data-driven goals, and these are directly related to our contract work. And then we asked some additional questions that we'll go over in a minute. The goals were ranked into these 8 priority areas. So the first one being implementing pain and opioid best practices. The second one to increase access to behavioral health services. And then 3, 4, and 5 were all around developing prevention of diabetes, identifying patients at high risk for diabetes complications, and improving management of patients with diabetes. So again, I think that was evident in the poll that we just did a little bit ago. So we definitely have some good knowledge that that's an area of high priority across our region. The other number 6 was improving care transitions to reduce hospital admissions. And I think some of why this one might have fallen a little bit lower is because all of you, like Joanne just alluded to, have been working on that for some time. And we greatly appreciate that those of you that have been existing for a long time are maybe even looking at taking on other things outside of care transitions and using that community coalition platform. So I think that's great that it can morph into taking on other issues in your local communities. The 7th one was to reduce the rate of ED visits and hospital admissions by superutilizers. This one, again, we've been working on for quite some time. And then number 8, of course, improving nursing home quality, which is definitely at the forefront of our work as of late with the COVID pandemic. Go ahead to the next slide. So we also asked just a kind of a basic question of what you were most interested in being actively involved in. And these items kind of rose to the top. The chronic disease self-management, which is reflective of those other priorities. And this would include cardiac and vascular health, diabetes, and we are getting a lot of interest in slowing and preventing end-stage renal disease. So that's great information. And then increasing quality of care transitions, reducing hospitalizations and readmissions. So, so those are 2 areas that kind of helped us even take that information a little bit further. Go ahead to the next slide. We also asked about your barriers and what kinds of things you run into when you're collecting data, because we know that there are a lot of asks out there for data, especially these days. So we want to be aware of what you are facing and try to help you through some of those barriers. So the first barrier that rose to the top was the lack of provider involvement in data collection. The second one, data may be old or not relevant, or because of data lags, then you're past the point of it being meaningful and useful. So definitely working on that. Data accuracy and analysis capability of the coalitions was a need. So all of this is kind of leading then to some metrics development and data training. So metrics and data training, metrics development and data training. Sorry, having a tough time spitting that one out. So Sarah will be talking later on how we're working on a curriculum around data training with to do with the coalitions as part of the project. So you really understand the value of the data and how to utilize it in a meaningful way. And hopefully we can train you and work with you in a way that then that's repeatable for you, and you can take that knowledge and use it in your own organization and your communities all the time. That's what we're shooting for. If you go ahead to the next slide. So a key part of the coalition data collection process is that we ask all of our coalition members to sign a data use agreement. So this is just our participation agreement and then our data sharing agreement. And what this really allows is us to share data with you. This is not necessarily us asking you for data. So this, we do need to have this document signed in order for us to be able to share the claims data that we do provide for the communities. So if you have any questions on that, let me know, but it is under our CMS contract that we have a utilization and sharing agreement with our coalitions. So if you have any other questions about any of that, you can let me know. And if you have any questions about data for now, or if anything, any other questions about the data assessment or wish list, you can feel free to speak up, or in the interest of time, you can chat with me while we move on to the quality health team updates.
All right. One question in chat, do you just need a data sharing agreement from one coalition representative or from all coalition members?
That is a great question. That we do need it from all of the coalition members, and actually the data sharing agreement is made so that multiple members can sign one agreement, which worked really well before we all kind of went to virtual meetings. So hopefully you can still make that work.
Very good question. We've gotten that question quite a few times. And so in the interest of time, again, if you do have any other questions, again, just use the chat function, or you can unmute yourself at any point too. So with that, we also want to provide some showcase of our work from Mountain Pacific, some upcoming events and some what's been going on here in the backside. So we are going to go through a few of these. We have a few Mountain Pacific team members that are just going to go through and do a quick recap. So first up, Sarah. Sarah Leek. You might be on.
I am. I'm on mute.
There you go.
I think I'm okay now.
Okay.
All right. So I think I'm going to highlight a lot of what Mary had mentioned about the data training. And based on that feedback from your survey, we heard that the key area is, one of them is providers. First of all, providers are really key users of the EHR, and they provide some very valuable patient information and data. So it's important that this information is available and it's timely. I think that's one of the things that you have run up against. And where it is expected, so that you can extract it and use it for your analysis. So that's one of the things that we would look at as an important factor when we offer data sessions. Also, the quality of data, it does need to be checked for validity and accuracy to make sure that you are starting at a point of confidence in that information. And EHRs are especially provide an abundance of data, so the challenge to identify metrics, it can be kind of difficult. You have lots of data that you can pull from. So what is the correct data that you can do in a combination and visually look at that to help you in your analysis? And then lastly, it's difficult in integrating patient data. So if you have a patient seen outside your organization and you need that complete picture of what they have had, there is some difficulty in pulling that all together. So we have heard what you're saying, and we do want to offer data sessions. We're putting them together. Some key areas that you have identified, we're looking at starting September of 2020 for these sessions. And we'll look at, we're probably going to approach it in a quality improvement, performance improvement model. And I'm glad Crystal mentioned the PDSA, because that's a part of the what we call QAPI also, and probably look at some of the electronic clinical quality improvement, which some of you may have done with some of our non-fed teams. And we're gonna hopefully do a demonstration, demonstrate it through something that is real. So the high priority health concern, of course, a lot of it's around diabetes. So we'll be be working through this and trying to have examples that are meaningful to you also. And in order to, we have a few survey questions, I think, or polling questions, and we just want this so we can pull it together and see where we can tailor these classes. So if you could bring up the first one, that would be great.
All right, so the first one, the question will be, what are some issues you encounter in collecting data? So go ahead and choose all that apply. And we understand, you know, there might be other issues. And so if there's other suggestions or other areas that you would like, you can also put that in the chat box as well. So we're getting some results in. Looks like a lot of people not able to find or capture data from EHR. Validity, consistent collection of the data. Let's see. Lack of access. Thank you, Mary. And feel free to unmute yourself. And so we have about 15 people. Just give it a few more minutes here. Can you see the results?
No, we aren't able to see the results right now.
Okay. They're just viewing the questions. Okay. All right. Okay, I've got about 30% voted. You can go ahead and show the results. All right, so we have a good portion not able to find or capture data from EHR.
Okay, well, we can look into that as a strong area to concentrate on. And I know we have staff within Mountain Pacific that have done a lot of that in their work. So, all right, the polling question number 2, Alana.
Yep. And that one will be using data for performance improvement. So select the steps that are most difficult. And you can choose more than one. So which is most difficult for you? And again, if there's another area that maybe is difficult for you, go ahead and type that in the chat as well. So we have about 10 people so far coming in. And this is helping us build that curriculum essentially for the data training. So your input is very valued. So thank you for responding.
And there's one more, so we aren't gonna,
yeah.
We're only pulling you one more, so.
One more question.
Yeah.
We're making this as interactive as possible. Making sure you're paying attention to us. All right, we got 33% voted so far, 18, 19. Let's see if we can get up to 40%. So the polling box should have popped up on your computer. Waiting, got 20 people. We're getting there. Come on, a few more people. You can do it. I know you can. All right. Perfect. All right, go ahead and show the results. Data collection. Perfect. Okay, and on to the third and final polling question. And you can go ahead and pull that polling question up, Mary. And it'll be, what tools have you used in data analysis process? And select all that apply. Okay, a couple people coming in. And then again, if you have others that you've used or experienced using, go ahead and put it in chat.
Yeah, there's several commercial tools out there, but kind of some of those are the common ones.
Mm-hmm. Yep. Yeah, there's definitely a lot of quick tools that you can use. I think a lot of people are pretty familiar with the Plan, Do, Study, Act, but all right, let's go ahead and show the results. All right, PDSA. Perfect.
That's great. We don't have to hammer in on that one much, but we'll work on other areas. So thank you very much. That was very helpful. Appreciate it.
Yes, thank you. So next, just a recap of the coalition training series that I did, and that was starting from June 18th through July 16th. We had a 4-part coalition series. I did put that in the chat box earlier of where you can find those recorded sessions. They were about 30 minutes in length, and then the last 30 minutes were using tools and practicing using tools, and then also coalition members sharing tips and tricks. The first session, we reviewed areas such as what the definition of a coalition is, how it is different or somewhat the same as a collaborative or consortium, and how to ensure you're doing activities that add value to your organizations and communities you serve. Then we also stressed the importance of building structure with your coalition with a charter, including a mission, vision, purpose, and objectives using SMART goals. The structure also included elements of logistics, such as consistent meeting time and date and consistent communication. Second session, we covered topics such as roles and responsibilities, how to leverage resources. Another important piece was data and understanding how you know you made a difference with evaluation using data. And then the third session, we talked about tips and tricks, collaborative decision-making, importance of trust building and transparency. And then we also practiced a root cause analysis. And then finally, the last session, we went deeper conversations about mission and vision of the and goal setting with strategy planning. And then we also used a couple CWAPI tools at the end of that session as well. And so I think a lot of the feedback that practicing using SMART goals and then also doing that skill inventory skill set that Crystal had referenced are utilizing those kind of resources. And I will be sharing those resources, and so check back at that link on our Mountain Pacific website. They'll be added soon. And so again, if there's any other tools or resources that you would like to share, please pass them our way. So with that, I'm going to pass it off to Patty.
Thank you, Alana, and thank you everyone for joining our call today. So I just wanted to take a minute and share something that we're doing in Montana, and we're looking to probably spread this across the whole region. But there's several contracts in Montana that are working together on similar items of focus, and which is chronic disease self-management. And we're going to actually work together to create a statewide learning and action network to focus on, we're going to combine our resources and focus on some specific disease states, at least for this pilot. The pilot, we're really going to just figure out the process, see what works. But initially, we're going to work on cardiovascular disease, diabetes, chronic kidney disease, and their related conditions. What we're really hoping to do is just combine resources, reduce the number of meetings, and try to use this Learning and Action Network as an education vehicle to send information through more efficiently and effectively through our state to start with, and then hopefully the region. So next slide, Alana. And as you know, these topics are applicable across the state and across our region. That's one of the reasons we chose them, and you can focus on them in all of our settings: hospitals, clinics, communities, and nursing homes. We'll utilize all standard best practices. So data, as Sarah has just been talking about, how to use your data and your EHR technology to help with your quality improvement. Clinical best practicing. Really, the key though is education and peer-to-peer sharing. Getting information like you heard today from some of those other coalitions, sharing what works. And then proven QI improvement, as Sarah also mentioned, the PDSA, PDSA quality improvement cycle and things like that. Really just to work together to improve outcomes for these conditions. Next slide. And this is kind of what the structure looks like. Again, this is the proposed Learning and Action Network structure for this pilot. And in Montana, I'm not sure if it's true in the other states, but Montana has a state health improvement coalition already set up. We have a state health improvement plan, and some of that plan addresses chronic conditions. So that'll actually feed in to our Learning and Action Network, along with stakeholders, subject matter experts, clinics and healthcare organizations, communities, and community resources and programs. So we're hoping that this LAN is really a vehicle that can focus a lot of different information coming from a lot of different sources and focus it and target to the clinics and hospitals and coalitions where they need it most. We do have some existing chronic disease work groups. Those will remain the same. So if you're part of the Million Hearts group or part of the diabetes work group here in Montana, or part of the state chronic disease work group, they still have their own specific goals and objectives. So those would still stay in place. We would just utilize the expertise from those work groups and have them help us drive the agenda and the topics. And then from this, really, we anticipate quality improvement affinity groups. So for example, if people want to work collectively around, as Sarah suggested earlier, the diabetes, how do you, some things that you can put in place to manage patients with diabetes better. Those could be affinity groups that roll out. And at the same time, as we're working on topics, often you identify additional research or work that needs to be done that you can bring back to the rest of the team. And those would be work groups. Coming up, we do have a COVID, we are focusing some education on chronic disease in the times of COVID. And that education is starting pretty, actually, if you just hold on a minute, I'm not ready for the slide, but that education is starting sooner. I think maybe someone else will be talking about the COVID education that's coming up, but that's a perfect example of the type of thing that at some point we will run through the statewide LAN. We're just not quite there yet, and the need for information on COVID is pretty immediate. Okay, next slide. And then the next thing I would like to share with everybody, here in Montana, we're working with the National American Heart Association and putting on an Advancing Million Hearts workshop focusing on cardiovascular disease, stroke prevention here in Montana. And it's a virtual event. It's September 17th. And you can read for yourself what our meeting goals and objectives are. And I will actually put a link in the chat for if you're interested in registering to participate on this. That would be, we welcome anybody. So any questions for me? Okay, thanks so much.
Great, thank you so much, Patty. All right, and so as she was talking about the chronic disease and COVID work group, I will let Stevie and Caitlin speak to it.
Thanks, Alana. So as Patty had given us a nice introduction on, we are working hard to meet the sort of emergent needs around COVID-19, and in particular, managing patients that have chronic conditions or other concerns that we know increase their risk of severe COVID illness, and using that as a backdrop to sort of emphasize to our patients about why it's time to get on top of these medical conditions. We're not quite sure yet data-wise whether or not improving outcomes will help keep patients safer, but I suspect as we move past this pandemic, we'll find that people who were able to have better control of their conditions did have better outcomes. So on the slide here, you can see the different things that we are pretty sure or do know increase risk for severe illness. So that'd be things like chronic kidney disease, obesity, obstructive pulmonary disease. And then there are other things that we're pretty sure increase the risk of patient severe illness. So that would be things like hypertension, particularly uncontrolled hypertension. We can go to the next slide, please. So we met as a quality improvement organization, and we really wanted to give healthcare professionals more timely information to implement some of these quality improvement projects to keep patients safer and improve their outcomes during the pandemic. And we also really want to engage patients to empower them over the long term to continue in their healthcare team. So we're building this learning and action network that will focus on chronic disease improved care during the COVID pandemic. It will include information on COVID, access to best practices on how to implement telemedicine, what next best steps can you do to help get people to goal, what's working in other practices. And then also we'll have representatives from the Mountain Pacific Patient and Family Advisory Council that will help provide some of the patient perspective so that as we're making changes in practice, we have really great knowledgeable patients that can help give us some ideas on how to overcome barriers on the patient side. Next slide, please.
Thank you,
And with
Stevie.
that,
Perfect. So we just wanted to give you guys the opportunity to actually register now. I just dropped the link in chat. We are kicking off our first session. It's called Uncontrolled Hypertension and COVID-19, The Time to Act is Now. So the first session will be on August 25th at 4 p.m. Mountain. Each of these sessions will be 30 minutes. So we want to make best use of your time and really make them interactive and provide anything from the relevant data to addressing those gaps and barriers, best practices, and then ending with a key takeaway. How do you implement this in your practice? And like she said, each of the sessions we have will really have that health professional focus, but also the integration of the patient and family voice. So if you're interested, please go ahead and register now. Thank you, Alana. Next slide, please. So it's a good segue into the last updates we wanted to provide around patient and family engagement. So we're, what we do here at Mountain Pacific is we really want our powerful partners to be proactive in our efforts towards improving our healthcare. So they're part of the team. We have them here at the team at Mountain Pacific. We want them to be the teams at our coalitions and sitting at the table moving forward. One of our next upcoming events is we are having a regional patient family advisory council meeting, and that's where we have patient family advisors from all 4 of our states who come together to really drive the work we're doing. So that one will be focused on what can providers do for you as the patient and how is this beneficial. So we're hoping to have them provide great insight into what's really happening with them, what interactions they have, and then bringing that forward so that we're able to drive innovation through that and bring that to you. Crystal, can you please share with everyone more on our state PFAC?
You bet. And again, I want to recognize Mary Schramke. I don't know if she's on the line still, but she is a patient family advisor for, she sits on our regional team. So I don't know if she's still on, but she was. So I appreciate Mary being on this call.
I'm here. Thanks. Thanks, Chris.
Hi, Mary.
Hey, aloha.
We do have state opportunities for patient advisors to be involved in our state. And we have a Wyoming team that's pretty active and involved, and right now they are they're doing a research project with the University of Wyoming around telehealth, and so that's an exciting project we're working on. And then Mary is going to be a guest speaker or presenter for a national conference that's coming up in September. So there's definitely large opportunities, big and small, for anybody who is interested in joining our team.
Great, thank you. And then I wanted to also give a shout out. We have a couple Mountain Pacific board members on the call, so I appreciate you taking the time out of your day. So Dr. Heidi Baines and Dr. Sharon Vitosek. I hope I'm not slaughtering that last name. So we have one from Alaska and one from Hawaii. So thank you so much for joining.
Thank you.
And last, we have just a brief nursing home updates.
Thank you. I'm Jill Holt. I recently joined Mountain Pacific. I'm the nursing home regional team lead. I work alongside Mark Marabella and Maggie in Hawaii, Lisa Johnson in Alaska, Marcy Gallagher in Montana, and Crystal Morris also works alongside me supporting nursing homes here in Wyoming. Our nursing home team has been busy assisting nursing homes, by developing resources and activities related mostly to infection prevention and control. Fortunately, we have a lot of partners in our states. We coordinate with the state survey agencies, nursing home trade organizations such as Leading Age and the healthcare associations. And of course, with COVID, we're looping in the state epidemiologists at least on a weekly basis. We have some regional infection prevention and control webinars and seminars in the works. We are also working on drafting some leadership training possibly for our area, or our region rather. And then we recently, for those nursing home folks, we recently launched a MDS series. It's a coding series. We started that the middle of July 17th, and that's a monthly training session. Our next session is in August on the 14th. Those are all 1 o'clock Mountain Time. So that's just a quick snapshot of what nursing home teams are working on right now. As you can imagine, mostly right around that infection control conversation.
Wonderful. Thank you, Jill.
Thanks, Alana.
All right, well, we are 1 minute past the hour, so I appreciate all of you for staying on and hanging in there with us. Just a big thank you. I know we have a couple of Mountain Pacific leadership staff on the call, so if you wanted to give any kind words of regard or appreciation, you are welcome to do so.
Well, this is Sarah Medley, everybody, and I just wanted to thank all of you for participating in this webinar. Your time is very precious and your work is even more precious to us. So thank you for all you do for those we serve. Take care.
Thank you, everyone. Have a great rest of your day.
Thanks, Alana.
Thank
Nice
you.
job. Bye.
Thank
Bye.
you.